Good afternoon, everyone. This is Dr. Bayan, and today's topic is about the gallbladder and the biliary tract. This video is going to talk about the simple concept of the gallbladder and biliary tract. If you want a more detailed version, I'll work on that for future videos. Now, before we talk about the gallbladder and biliary tract, let's think about why do we need the gallbladder actually, and where is it located, and we're going to start from there. Now let's say the structure is the liver. Where is the location of the gallbladder itself? The gallbladder is located over here in the bed of the liver. And if we take this gallbladder as an individual structure that is located within the liver itself, we could think of it as like a sac over here that has several components, including the fundus, the body over here, and the infundibulum. This gallbladder is really important because it stores the bile, and the bile is a really important component that helps us emulsify the fat. Whenever we eat some foods, we need to emulsify the components of the food. It will help and aid and facilitate the digestion of the food. So this bile is really important for our GI tract and for our body in general. In order for the structure for this gallbladder to contract, it requires certain indicators in the body, such as CCK, which stands for cytokinin. It's like a peptide hormone that stimulates the digestion by contracting. One of its function is contracting this gallbladder, and so whenever it contracts, the bile is going to pass through the duct, and it will go through a certain tract that I will get into the details of in a few seconds. That would help and aid in the digestion of the food. Now, before we get into this tract, let's just go back to the liver. The liver has two main ducts. We have the right and left hepatic ducts. These terms are actually self-explanatory. We have the right and left hepatic, again referring to the liver, forming the common hepatic. The right and left forming the common hepatic. This common hepatic has a course in which it is going to be joined with the duct coming from the gallbladder itself. This duct is called the cystic duct. So when both of these are joined together, they're going to be forming the CBD. CBD refers to the common bile duct. As you know, when we were referring about the liver ducts, we said hepatic because they were just coming from the liver, didn't have any bile that came from the gallbladder. However, when it joined the cystic duct, it is called the common bile duct. This common bile duct, also referring to as the CBD, actually requires other enzymes that will help aid into the digestion. This organ over here, can you guess which organ is it? It is the pancreas. This pancreas over here is going to release certain enzymes into its own duct called the pancreatic duct. These enzymes are also going through a route that would join with the contents coming all the way from the common bile duct. As you can see, this is the pancreatic duct joining over here. Both of these, the common bile duct and the pancreatic duct, are going to be joining together. When it joins together, it's going to be inserted into the duodenum. Let's draw the duodenum into pink color. Let's say that this is the duodenum over here. It's going to be inserted into the second part of the duodenum. It is basically the first component of the small intestine, and it will help into the digestion of the proteins, of the fats that are contained within our meal. That's why some patients are going to have the symptoms. Basically, when you ask the patients, you would notice that if they do have a stone over here or over here, anywhere within the biliary tract, they're going to have these symptoms more prominent if they are eating fatty food. They're going to tell you, doctor, I feel like whenever I eat any meal with heavy oily content, that's when my abdominal pain is going to increase. And I'm going to talk further about these symptoms